Hi, my name is Karlee Alberty, and I'm currently a second year student in the Masters of Athletic Training program here at Oklahoma State. Today, I will be presenting over my latest research. The title is The Effectiveness of Functional Bracing in Athletes with Anterior Cruciate Ligament Reconstruction on Function, Stability, and Biomechanics, a critically appraised topic. I am the head author. My co author is Jonathan Herrick, and our faculty reviewer is Dr. Eric Warren. Healthcare professional or not, we all know the ACL injuries are common, especially those who are active or evolve. Hi, my name is Karlee Alberty, and I'm currently a second year Masters of Athletic Training student here at Oklahoma State. Today, I'll be presenting over my recent research. The title of my research is The Effectiveness of Functional Bracing in Athletes with Anterior Cruciate Ligament Reconstruction on Function, Stability, and Biomechanics, a critically appraised topic. I am the head author of this project, my co-author being Jonathan Herrick, and our faculty reviewer being Dr. Eric Warren. Healthcare professional or not, we all know ACL ruptures are among the most common injuries that occur each year. In fact, approximately 200,000 ACL injuries occur each year in the United States, with about half of these undergoing ACLR or ACL reconstructive surgery. Currently, the treatment for ACLs post-reconstructive surgery often involve the use of a functional brace to aid in the rehabilitation process by providing stabilization and protection to the graft by reducing mechanical loads and supporting early motion. According to the American Orthopedic Society for Sports Medicine, postoperative braces are used in about 85% of ACLR cases. Some reports suggest that wearing a brace can be both uncomfortable and inconvenient, where other studies have shown that brace wearing has helped reduce the extension deficit and help the patient feel more stable. While the effectiveness of the use of a functional brace post-ACLR for return to sports or high levels of activity is still unclear, many physicians still opt to prescribe and recommend bracing for the first postoperative year. My focus clinical question for this research was, what is the efficacy of functional bracing on the function, stability, and biomechanics in athletes with reconstructive anterior cruciate ligaments? My PICO is listed here, with my patient group being athletes or those who are physically active, my intervention being functional bracing compared to no functional bracing, with an outcome on function, stability, biomechanics, and patient-oriented outcomes. I conducted this search in November of 2020. The databases I searched were PubMed, TRIP, the Journal of Athletic Training, Pedro, and Google Scholar. The search terms I used were anterior cruciate ligament reconstruction, bracing, kinematic, knee stability, kinetics, and ACL functional brace. Articles that were included in this critically appraised topic, if they were available in the English language, published within the last 10 years, articles that address the use of functional bracing post-ACLR, studies that reviewed the physically active or athletic population, articles focusing on rehab post-ACLR, and articles that were level evidence 2 or higher. Articles that were excluded from this critically appraised topic if they did not involve functional bracing, they did not research the physically active, they were not level 2 or higher, they did not focus on rehab post-ACLR, they only focus on the early phases of rehab, they focus on one specific knee brace, or they were before November 2020. Here is a chart with the 3 articles that were included in this research. All of these focused on ACL bracing post-ACL reconstructive surgery. All of these articles concluded that, in general, knee bracing does not appear to improve the clinical outcomes on function and stability of the ACL reconstructive knee. So, our clinical bottom line is that there's moderate evidence to support the idea of discontinuing the use of ACL functional braces post anterior cruciate ligament reconstructive surgery for the function and stabilization of the ACL reconstructive knee. Currently, there's no existing functional brace that has been successful to restore normal anterior stability to the ACL deficient knee and improve long-term patient outcomes following this surgery. Functional bracing is not cost-effective. ACL braces should not be routinely applied for ACL reconstructive patients and there is significant evidence to support the decision to discontinue the common practice of ACL bracing post-anterior cruciate ligament reconstruction. Listed here are the references for both the articles included and other helpful articles that helped me along this research process. Thank you for your time and for listening to this video and for reviewing my poster. If you have any questions, comments, or concerns, please feel free to reach out to me at the contact info listed at the bottom. Thank you very much.